Dr. Lillian Walker is going to be coming and telling us what she has discovered personally. She works with people who have had brain injuries. And for those of you who have listened to us, you know that that's particularly close to my heart because I have a daughter who suffers from a brain injury, and it is substantially saddened in many ways. So I'm anxious to see what tips and comments she can give me and even help me more with Annalise. So Lillian, come on and tell us a little bit. We know a little bit about yourself, but I understand that you were hit by a bus. Is that correct?
That is correct. I was hit by an Orange County Transit Authority bus just 3 blocks shy of finishing or completing a 16-mile bike ride. And I was hit from behind. And so I went flying off my bike, had a traumatic brain injury, a neck injury, lower back, as well as my right leg. I suffered a laceration from my ankle up to my knee, right along the shin bone, very unpleasant. And so fast forward a few years later, and here I am now talking to you on this wonderful podcast about stem cell activation patches.
Well, how were you introduced to stem cell activation patches? I know they have a great deal to do with your recovery, but tell us how that introduction happened, please.
Yeah. So I've been writing a book based on Dr. Nirmala Krishnan's medical thesis. She actually went to the same medical school as Dr. Stacy Hallweger and also Dr. Mel Hashemi. And so we're always trading information. And if we have, different issues with patients, we cross-reference information and kind of get second opinions from each other. And so she told me about a little over a year ago, she said, hey, listen, I'm part of this research team. They're going to Belize and they're going to be using these stem cell activation patches. I thought you might be interested in something like that. And at the moment I heard she said something having to do with stem cell and then activation patches, that was like, bzz, wait a minute, they've got activation patches for stem cells. She had me at the word stem. I was already very familiar with stem cell activation from the traditional standpoint. And I had also, from my past, I used to have a radio show called the Bottom Line Show Live, and I had interviewed Dr. Bruce Lipton, who is the father of modern epigenetics, wrote The Biology of Belief. And as many of you are probably not aware, unless you've read his book or listened to some of the interviews about him, but he started doing stem cell cloning and stem cell research before I was even born, back in 60, 61, 62, 63, 64, and 65. He was already doing that. And so when I had him on my radio show, I became aware of that. And I thought, holy smokes, when I was pre-med at USC, they never talked about stem cells. That was something that came much, much, much later. And so fast forward to Dr. Nirmala telling me about stem cell activation patches. I didn't need a sample. I knew that I wanted to read the clinical research papers because she told me about the Department of Defense and how they approached David, and that was originally how this whole thing got started. And I said, how quickly can I get my hands on the patches? Yes, I will fly to Belize to be part of that research. And I would like to get my hands on the patches, for my patients and of course also for myself. And I'd like to see, how many of my patients might be, it would be of their benefit mutually for them to be part of the research studies. So long story short, I immediately got started on the patches. And it's funny because for the first month, well, not just the first, it took a month before I actually got started on the patches, because I personally didn't start on the patches until June 22nd, because my patients are a lot of my patients reach out to me from ERs, from intensive care unit or ICU, or from a hospital bed. So they're in critical condition for the most part, kind of more emergent situations. So as soon as
Lillian, I'm going to interrupt you one moment because I know our time will go fast. Tell us what your specific issues were.
Okay, so I have a laundry list of issues that were wrong. Okay, so first of all, when you suffer a traumatic brain injury, you either suffer short, mid, or long-term memory loss. So I had short-term memory loss. What's interesting is that for almost the first 2 years, I was unaware that I had short-term memory loss. When you suffer an accident like this, you're in so much pain And especially my neck and my lower back pain, even more so than my right leg. It was really walking on eggshells, trying to minimize and mitigate the pain going from an 8 or 9 to like 15, like nuclear. And so any little flinch, any hiccup, any cough, any, if a door slams because there's a wind current and you flinch, it's already, like I said, you're already at a pain level of 8, 9, or 10. Now, just when you thought it couldn't get worse, you feel like you have an ice pick that's being screwed into your neck and your back at the same time. You don't know how much more you can handle, if you're going to pass out, and if so, what's going to happen, right? And so I had a whole list of things like short-term memory loss. I had very impaired vision. As soon as I had that happen, I had very blurry, vacillating vision, where I remember after a few months, I ended up going to the ophthalmologist to get prescription glasses. And even during that appointment, they prescribed 2 pairs of glasses, neither of which really worked for me, because I still had to use a magnifying glass and like a magnifying sheet and a magnifying glass in order to be able to adjust and then go back and forth between different glasses, to read. Because for probably the first 4 months after my accident, I really could not read because I could not focus at all. I couldn't read my cell phone. I couldn't look at an email. It's very difficult. I had a lot of sensitivity to light. I had stuck brain where you can't, not only can you not focus, but you can't think. So you're like in this stuck brain where you can't even recall what it was you were trying to think of or try to say. You can't concentrate. You have foggy brain. You have blurred vision. I had tinnitus. I'd see shooting stars. I had vertigo. I had really acute insomnia. My insomnia was so bad that it would be 3, 4, 5, 6, 7, 8, 9, 10, 11 in the morning, and I still could not get to sleep. Sometimes finally by 11 or 12, I would finally fall asleep. Then I could only stay asleep for 3 hours, and then I was awake again. I also had loss of appetite. I had zero appetite. I was never hungry. I lost like 8 or 9 pounds that I couldn't afford to lose because I've never been overweight. I've always just been regular, kind of more on the slender side. And so then I was super skinny. I also had, of course, the bald spot about several months. I don't remember exactly about when that showed up, but I started losing a lot of hair. I ended up losing about 50% of my hair. And then my neurologist had diagnosed me with alopecia areata, which is from the trauma, the blunt trauma that you receive from the accident. So I had a couple like quarter-sized bald spots on the top right of my head, but the big one was my point of impact from behind the head, which was the size of my palm. I had another one also above my left
David,
ear.
hi, it's Kathleen. Are you on the call?
Yes.
Oh,
Okay. So I had those bald spots. I also had something called nystagmus, which is very common with people who have traumatic brain injuries. And what happens is that you go to focus on something, it happens out of the blue. You can't control it. You'll be focusing at something, and then for no apparent reason, your eyes will just rattle back and forth for about 1, maybe 2 seconds, and everything rattles. And then it feels very strange in your eyes to have your eyes rattle like that, and then they stop. And then you look at something else, and it's just when you focus, but you can't control it. So that was another thing. I had all sorts of your whole biological chemistry is out of sorts because your brain, as you know, is your central processing unit for the body. So when you go offline, that's what happens when you get a traumatic brain injury. It's kind of the equivalent of your computer, and you have all your programs that are stored in your computer that you can readily access because they've been there since basically you started using your computer. But then you also have your internet connection, which allows you to access new information, to download it, to recall it, and to use it. Well, when you have a traumatic brain injury, it's like your internet connection is gone and you can't access new information, and you have trouble even pulling your old files. In my case, I had no short-term memory. So if I spoke to my daughter 15 minutes before, or if I spoke to her in the morning, forget if I spoke to her the day before, to me, that never happened. So I would have my daughter say something to me, because we had breakfast together or we had dinner together. I agreed to something. Then, she would see me in the evening and she would say, oh, did you, pick up my laundry, or did you pick up that cartridge or the thing at the art store? I'm like, what are you talking about? I haven't
how
seen you all day.
difficult.
I go, not only have I not seen you all day, I didn't even see you last night. I haven't seen you for
Wow.
days.
So
And
tell us what the first results were for you. When did you start seeing them? How, because people are asking how long were you on the patches and when did you see results?
so I immediately, when I first started on the patches, my first thing was, okay, we've got 12 patches. What am I going to need? I quickly realized that the X39, 49, glutathione, carnosine, and eon, I recognized that those were like the fantastic five, the patches that take care of the primary systems of the body. And then I also noticed that SP6 had to do with regulating your autonomic nervous system. And also it affects your organ function and your hypothalamus. And I'm like, I need that. And I also, the appetite thing, I already had regained my appetite and regained my weight back, but I knew that I still had issues that needed to be repaired. And so I was wearing those 5 patches along with the SP6. About the 4th month, I added Nirvana because of the pineal gland. It activates your circadian rhythms.
Excuse me, Lillian, you had such a huge list of things that were wrong. What were your results? Like, we really want to get to the juice of what's happening.
So the results were this. When I first put on the patches, I can honestly say I was like in the 20% that didn't feel anything. I noticed that the first night I had deeper, sounder sleep, but that was it. The 3rd week, between the 3rd and 4th week, in that first month that I was, wearing the patches, I was also reading all the scientific research papers, and I knew that I was going to have to, the ones that were the most captivating, that I was going to have to commit them to memory. I was going to have to learn them. I was going to have to memorize things so that I could speak intelligently and quote them. So in the 3rd to 4th week, I had read the Tang Maritas University ice wave study. And that particular study caught my attention because it talked about organic nanotechnology, photobiomodulation, and acupuncture points. And those were the key words. And I remember thinking, oh my gosh, nobody is using these key words as they express this to others. I gotta remember this. I gotta commit this to memory. So I figured I was going to have to highlight it. I was going to have to make note cards.
Lillian, speaking again, I'm so sorry, but
Okay.
we really need to know your results.
Okay.
What were your results on the patches?
So this was the result. In that 3rd to 4th week, even though I only read the paper once, I literally took the paper, set it down going, okay, I'm going to have to review this to commit it to memory. The next day, I'm on a Zoom call doing an info Q&A with my people. And without having reviewed that paper, I saw the paper in my head. I was able to recall the keywords. I was able to recite the abstract back, which was a nice synopsis of what the ice wave patch could do. And I realized in that moment, in that second, I thought, oh my gosh, my memory is back to where it was when I was pre-med at USC or maybe even high school. And then in the day that ensued, I realized, no, it's better than it was my entire academic career. It's even better than it was because it was one time reading, and my intention of learning it and memorizing, there was no effort for me to learn it or to memorize it, let alone to recall it. So that was my first big, wow. And then, of course, I noticed.
And that in itself is so significant. That is so significant because with all of the issues that you have.
I had a big laundry list. And so that was my first realization. It's like my brain processing speed, my memory, my focus, it was instant recall. And I thought, wow, I haven't had that. So to go from, like when I started on the patches, I had recovered my short-term memory, but I had to do a lot of effort still to memorize and learn new things. And so all of a sudden, this was evidence that no effort to learn, to review, to memorize, to recall, to recite. And so that was like a big game changer for me. At some point, I really don't know when, like the nystagmus, which is kind of a big neurological indicator. If you have someone that's trying to look, they can't use both eyes at the same time. It has to do with left and right hemisphere brain engagement and what we call binocular vision. The fact that at some point the nystagmus it stopped happening. I don't really know when that stopped, because it wasn't until after 2 or 3 podcasts ago that I realized, wait a minute, I don't think I've had nystagmus at all since 2023 started. So somewhere between June of last year and the beginning of this year, that disappeared. In the 4th month, I did get about 70% of that previously bald spot grew back. And so I had about 3 to 4 inches, which I had tried all sorts of different things, including compound pharmacy formulas that were proprietary and organic, but nothing had worked until I got on the patches. And I have probably, like I said, I originally lost 50% of my hair. I probably have regained 75% of that since I started on the patches.
Well, I know for one, I could sit here and continue to listen to you for the rest of the night because of all that you have. And I really appreciate the very fact that you were on those patches for that length of time with all of those issues. Those are remarkable results. And we'd really like to have you continue from where you are now and come back and join us.
Love to.
Thank you so much for what you've given us. I know that we'll have people look into your information for further information that they could use to help. So thanks again. Kathleen, I'm let you go ahead. I understand that our other testimony is on the line now.
Yeah, actually, you know what, Lillian, you had so many results. We're just going to stick with you, okay? Because we're kind of running out of time. So go ahead and tell me if you can just briefly list like what other results you had. I mean, the memory is absolutely amazing. The brain coming back online. So were there other things like, you know, like 3 or 4 or 5 other things that we can just round out it with? That'd be fantastic.
Yeah, in the second month, I was really surprised because I didn't have that prior to my accident. But I noticed that as I was bike riding, I noticed that I could tell people who would use Tide detergent as opposed to a different detergent. So one of the things that you lose when you have a traumatic, a lot of your senses, whatever, you know, it's your visual, your auditory, your olfactory, gustatory, and even your sensation is altered when you have a traumatic brain injury. And so I noticed that my sense of smell was increased. And so that was significant. So if I would walk by a house that had cats, I could tell if the kitty litter box was like at the front door, things that I didn't before. So that was increased. Also, when it comes to vision, I talked about, my vision got clearer, but I used to have tired eyes after my accident, which was very strange for me to experience. I don't remember the last time I had tired eyes where your eyes just get tired. And so I don't get tired eyes anymore. The other thing was my scar on my right leg. This was really significant because my scar originally was from my ankle to my knee, all along my shin bone. And I didn't fracture that leg when I had my accident, but it did when I had the laceration. It made the bone, where the integrity of the bone was altered, so it was wavy. And so the scar was wavy and it was thick and it was elevated and it was kind of purplish. So in a matter of, I'd say 3 months, the scar shrunk and it became flat and it became very, very light brown where you could barely, like even now, I mean, I can definitely see it and it's not 100%, but I'd say it's about 90 to 95%. There's no question in my mind that scar will be 100% gone, where there will be no evidence of that income. It'll be back to normal again.